Hello again. Welcome to Ask Dr. Payne, where we take your plastic surgery questions and answer it to the best of our ability. Today is a question from someone that lost a lot of weight after basically bariatric surgery. So they've got a lot of excess skin and they want to know, do they need to do upper body work first or lower body work? And they don't specify exactly what type of operation we're talking about. But in general, if we're talking about upper body work, we may be talking about breast surgery, the flanks, if there's extra skin down the flanks, the arms, face, that kind of thing, versus lower body work, which would be like a lower body lift, thigh lift, different types of abdominoplasty, beltectomy. There's a lot of these different operations, and it can get confusing. In general, if we're talking about the trunk of the body as opposed to, say, the face, the arms specifically, or the breasts, usually you're going to start with the lower body work first. Now, that doesn't mean a lower body lift. It depends on what kind of laxity you have. Usually, most people are going to do well with what they call an extended abdominoplasty if there's been a lot of weight loss. When you do work around the trunk first, you're going to have a little bit of a pull-up effect on the thigh. So that's why I recommend that first rather than going to a thigh lift first, unless you've already had a tummy tuck, you don't have a lot of laxity of the central abdomen, or you just don't care and the thighs are most important to you. In that case, then for those people, a thigh lift may be the best first step. But in general, most people is going to be something related to the abdomen, whether it's an extended abdominoplasty or a circumferential abdominoplasty where you go around the back and take that tissue along the back as well, or what they call a lower body lift. Now, it gets a little confusing in terms of the terminology. People will tell you, well, I'm doing a tummy tuck and an outer thigh lift and all the rest of this. A lot of times that is really an extended abdominoplasty, how far you extend around the back. So I may call it a circumferential abdominoplasty, and some other surgeon may call it a tummy tuck with a outer thigh lift and a back thigh lift. Where it gets a little tricky too is if we're talking about these things being billed to insurance companies. That's a whole separate topic which we can't get into right now. But in general, lower body work is going to be first for most people. Not all, depends on your specific situation, but then that's because you're going to have a secondary effect on some of the other areas rather than doing them first. So again, an in-person consultation is important when you're talking about massive weight loss, because those patients, there's a lot more skin looseness. It's a more challenging situation than a standard run-of-the-mill abdominoplasty. But in general, lower body lift first, and we will talk to you next time.